Hi, it's Vivian again. So, I already have a question. I'm so excited. So, um, a friend in Illinois just asked a really, really good question, and I'm really excited that this is my first question because everyone knows, first of all, I am like such a goofy, silly, crazy person, and whatever problem, whenever I go from hospital to hospital, the whatever problem that they have, if it's like C. diff, I like people tell me in the hallway, that's the poop lady. And I'm like, I love poop. You have no idea how much I love poop. So so this question is about UTIs, and I love pee. It is like my jam all day. And so the question is, what causes the elderly to become disoriented when they get UTIs? And so not only is this kind of a loaded question, first of all, I'm going to say, I don't know. There's so many layers to why this is, but I'm going to start off by saying, I don't know. As an infection preventionist, there's I mean, as a nurse, I do not know. But as an infection preventionist, my job is to look at patients' charts, see the patients that come in, and see who has an infection on admission and who has an infection in the hospital. I want to make sure that I find people who have infections at the time that they come into the hospital. If they have an infection at the time that they come in the hospital, that infection is found to be present on admission. I want to prevent any infection from being caused by the hospital, right? And so the when as a scientist, the rules that we're putting everything under the label of a UTI or a urinary tract infection or a catheter-associated urinary tract infection, we need criteria so that everything is very strict. We can't really have different kinds. Me go by one set of rules and somebody else go by a different set of rules. So everybody has the exact same book telling us what is a UTI. So we've noticed over a long time that elderly people act differently compared to a 21-year-old, compared to a 2-year-old, compared to a 2-month-old. And so understandably, there are different rules. But there are some of the rules that we have come to a conclusion on are very focused on the bladder. So, except for a fever, everything is pretty focused. So, suprapubic tenderness is low abdominal pain, like it's over your bladder. Costovertebral angle pain is like kidney pain. It's like flank pain, side pain, and you would feel it in your sides, in your love handles. Urgency, feeling like you have to pee, like right now. Frequency, peeing all the time, and dysuria is pain while you're peeing. And so when you're older or younger, too young, and you can't tell someone, I have pain, or I gotta go. If you can't tell somebody that, you can't communicate that, the only option in those things there is just fever. And what we found is that some older people don't have fevers. They have dysregulation. And so if they don't have a fever, doctors clinically, so now you're going from epidemiology, which is looking at trends and data of how the entire public works, to clinically trying to treat this one person and what they look like. You kind of see different things. So this is how Vivian Sterling presents. I come in and I am not eating, I'm tired, I'm weak, and I don't know what day of the week it is. That's weird. And so that doctor trying to treat me is going to want to look at everything. Also, as you notice, white blood cells, usually when they go around your blood, they look for bacteria. And if they find bacteria, they call their friends and say, hey, something's up in the bladder. Let's go nuts. And they go to the bladder and try to fight that infection. White blood cells being increased is not in that criteria. There's actually a lot of reasons. There's a lot of reasons why white blood cells is not part of that criteria, because it can be a false positive. And so it's not in that criteria because it doesn't want to overestimate urinary tract infections. And clinically, you don't want to overtreat urinary tract infections if you are just looking at white blood cells. If you based your medical opinion on just confusion could also be a stroke, it could be a seizure, it could be a lot of other things. And so these definitions, except for fever, because fever is almost largely infection, we can't rule out that fever is the UTI. These are very site specific. And so we want to focus on the UTI. Another good reason why it's really good to clinically treat based on these definitions is because we're having a really huge problem with antimicrobial stewardship. Any stewardship is when you use something appropriately and you say yes when it's a good idea and no when it's a bad idea. And so we're having a hard time with antibiotic use. And so when you have people who are elderly, if they have family that knows their mental status and says this person is absolutely good, they know their ABCs, they know what day of the week it is, and now they don't know which end of the stick is up, then that's bad. Then their mental status should be taken seriously. We have a problem with a lot of people who are confused all the time, and maybe if their mental status were to change minutely, you don't know if they're just, getting worse as part of their normal process, or if something else is wrong. And they just don't have family to speak for what's normal for them. And that's a really important part of their care, is having someone who knows them speak for what's normal. So I really like that question. And it opened up a whole can of worms that can just keep going forever. I'm gonna put my references in the comment section. There actually is an article by the National Institute of Health about this very topic, delirium, a symptom of UTI in the elderly, fact or fable. And they looked at they did a systematic review of articles from 1966 to 2012, and it looked like the studies, let me just read the conclusion. Few studies have examined the association between UTI and delirium, though the studies examined conclude that there is an association between UTI and delirium. All of them had significant methodological flaws that likely led to biased results. Therefore, it is difficult to ascertain the degree to which UTI, urinary tract infections cause delirium. More research is needed to better define the role of UTI in delirium etiology. So, I don't know. Really great question. Bye.